Did you know that 80% of all lost teeth are not lost due to cavities, but because of inflammation? And what's surprising is that the main cause of this inflammation could be your metabolism, not your brushing technique. Welcome to a new video from Professor Rosin and Partners. I'm Dr. Reinhard Dittmann, and today we're going to talk about a largely unknown connection. Specifically, how your metabolic health, especially insulin resistance, is directly linked to the loss of your teeth. This is a topic that is addressed far too rarely in conventional dentistry. In this video, you'll learn why even people with good oral hygiene sometimes suffer from progressive dental problems, what role insulin plays in this, and most importantly, what specific steps you can take to keep your teeth healthy for a lifetime. After watching this video, you'll understand why the path to healthy teeth goes far beyond just brushing your teeth. Since the founding of our practice in 2006, we have been deeply engaged with the connections between overall health and dental health. And in my nearly 25 years of experience as a dentist specializing in tooth preservation, I have repeatedly observed that conventional treatments do not achieve the desired results for some patients and why a holistic approach is necessary. By the way, at the end of the video, I'll share with you a surprisingly simple trick to improve your insulin sensitivity. It's a method that most of my patients have never heard of, but which is well supported by scientific evidence. But first, let's start with a fundamental problem. Most people lose their teeth due to inflammation of the periodontium, known as periodontitis or periodontal disease. You've all heard of it before? Yes, we all know that bacteria and dental plaque can trigger this inflammation. But what many people don't know is that the intensity of the inflammatory response is largely determined by metabolism. Yes, imagine it like this. The bacteria are like a spark that could fall onto dry grass. And in some people, the ground is, so to speak, dried out by an inflammation-promoting metabolism, and the fire simply spreads much faster. With others, the ground is moister, so the inflammation remains contained. And this difference in reaction strength depends on how many inflammatory messengers, yes, we call them cytokinase, circulating in your body. And the more of these messenger substances are present, the more intense this inflammatory reaction becomes, even if the bacterial load is identical. As a result, this simply leads to faster, more severe bone loss and earlier tooth loss. Now, here comes the crucial point. These inflammatory messengers are significantly stimulated by an elevated insulin level. This means that people with a persistently elevated insulin level essentially have a body that reacts to the same bacterial load with a much stronger inflammatory response. So, have you perhaps noticed that your gums bleed or recede despite good oral hygiene? Or do you perhaps know someone who keeps having problems with their periodontium despite regular dental checkups? Feel free to write it in the comments. I'm really curious to see how many of you are familiar with this problem. So, let's get to the heart of the problem, insulin resistance. Yes, insulin is, first of all, a hormone that we need and that ensures sugar is transported from the blood into the cells. However, when our cells no longer respond properly to insulin, we call this insulin resistance. And the tricky part is that in the early stages of insulin resistance, blood sugar levels often remain normal because the pancreas simply produces more insulin to get the sugar into the cells anyway. Your doctor then tells you that your blood sugar level is perfectly fine, and patients are lulled into a false sense of security. To give you another analogy, it's like looking down at a car driving straight down the road. You can't see how much the driver is struggling, maybe because the car keeps pulling to the right the whole time. Ideally, the car should drive straight on its own without you having to make any effort. But now imagine, for example, the brake on the right is stuck or the tire doesn't have enough air and the car keeps veering to the right all the time. What do you have to do? You basically have to keep steering against it the whole time, and you might be struggling and even sweating in the car, but from the outside, someone looking at it only sees that the car is still driving straight, staying within the correct lane. And that's how you can imagine it with blood sugar. That means if you only measure your blood sugar, you only see whether the lane is being maintained, so to speak. But you don't see how much your body is already struggling to keep this state going, and it does this by increasing insulin. And what is often overlooked is that the elevated insulin level itself is also a problem. So it's not just the elevated blood sugar level that's a problem, but above all, the elevated insulin level is a problem. This leads to increased production of inflammatory messengers such as TNF-alpha or interleukin-6, and these messengers then circulate throughout the entire body and intensify every inflammatory reaction, including, of course, in the gums. And now the question is, how does this elevated insulin level actually come about? Of course, it's because there's simply more sugar in the blood. And now the question is, how does the sugar get into the blood? There are three main causes for this. First, diet, yes. And here you have to keep in mind that when you eat sugar, this doesn't just mean table sugar, but basically all available carbohydrates, which are of course also found in bread, potatoes, pasta, and rice, all lead to an increase in blood sugar levels. Second, lack of physical activity. Without regular physical activity, the insulin sensitivity of your cells decreases. And third, and this surprises many people, chronic stress. Your blood sugar level also rises when you're stressed. How does that happen? Your body releases hormones that cause sugar to be released from the liver into the bloodstream. When does your body typically experience stress? When you have to fight or flee, only then is that sugar actually burned off. But in everyday life, we usually end up sitting at our desks. And now the stress trigger is no longer a saber-toothed tiger, but maybe the phone, a coworker, your boss, or a customer. So now the sugar stays in your blood and has to be broken down by insulin instead of being burned off. So this means that chronic stress is basically just as harmful to your insulin levels as eating sugar. Let me illustrate this with an example. A few years ago, a 45-year-old patient came to our practice. Despite really good oral hygiene and regular professional dental cleanings, he was still struggling with progressive bone loss. However, his general practitioner had assured him that his blood sugar levels were perfect. So we sent the patient to my wife, who is a specialist in internal medicine and focuses on prevention. And there, not only is blood sugar measured, but also insulin. And the insulin showed a significant increase. Yes, a classic case of prediabetes. You have to imagine, between someone with a completely healthy metabolism and a diabetic, there are probably about 20 million people in Germany who are already insulin resistant, but whose blood sugar levels are still, let's say, within a reasonable, proper range. Yes. And in this case, that's how it was. The patient was an executive at a company, regularly working, so to speak, 12 hours a day, often eating fast food on the go, and no longer had time to really exercise. So, and only after he really, I would say, completely changed his lifestyle, adjusted his diet, exercised regularly, and learned proper stress management techniques, did his insulin levels improve and drop significantly. And of course, the condition of his gums also improved dramatically. Yes, within just a few months, his gums completely stabilized and teeth that had previously been loose even became firm again. Yes, and so the progression of bone loss could also be stopped as a result. And this happened even though we actually didn't change anything about his dental treatment. Yes, we carried out our usual periodontitis treatment, just as we always do, but without the lifestyle change, it definitely wouldn't have been as successful. So, how can you now improve your insulin sensitivity and thereby reduce your body's tendency toward inflammation? Here are the most important measures. First, regular physical activity. I know, it's exhausting, but you should definitely plan for at least a bit of exercise every day. Strength training and high-intensity interval training are, of course, especially effective. But I would say even if you just go for a walk, yes, that alone already improves the insulin sensitivity of your muscle cells. So, secondly, dietary changes. Yes, make sure to reduce your intake of fast-acting carbohydrates and, above all, increase the amount of, well, I would say, vegetables, healthy fats, and high-quality protein. And it's also important that you don't have carbohydrate-heavy meals too often. So it's not just about the total amount, but also about the frequency. Yes, keyword, intermittent fasting. If you really manage to keep your insulin levels or your blood sugar levels consistently low for 16 or even 18 hours in a day, so that no insulin is triggered, then this will dramatically improve your insulin sensitivity as well. Thirdly, there are also certain foods and spices, for example, cinnamon, that have been well studied. Cinnamon, for instance, improves insulin sensitivity, meaning that after a carbohydrate-rich meal, the insulin response is not as strong because the insulin sensitivity is simply improved. And fourth, of course, proper stress management. Yes, just consciously schedule a few relaxation phases into your daily routine. These can be short meditations, breathing exercises, or simply moments of calm. Because chronic stress is a major driver of insulin resistance. And fifth, getting enough sleep. Even just one night of too little sleep can temporarily reduce insulin sensitivity by up to 25%. The great thing about these measures is that they not only improve your dental health, but your overall health as well. Improved insulin sensitivity also protects against heart disease, for example, against stroke, dementia, and many other chronic illnesses. Let me briefly summarize what we have learned so far. Periodontitis, the main cause of tooth loss, is triggered by bacteria, but the intensity of the inflammatory response is determined by our metabolism. An elevated insulin level leads to more inflammatory messengers in the body. These amplify every inflammatory reaction, including those in the gums. The main causes of increased insulin are unhealthy diet, lack of exercise, and chronic stress. Through targeted measures, we can improve insulin sensitivity and thereby reduce the body's tendency toward inflammation. At the beginning, I promised you a simple trick to improve your insulin sensitivity. Here it is. After every meal, take a short walk of just 10 to 15 minutes. Studies show that this simple measure can reduce the rise in blood sugar and insulin after a meal by up to 30%. The active muscles absorb sugar directly, even without insulin, via so-called insulin-independent glucose transporters. And at the same time, you are training your cells' insulin sensitivity. It's a win-win situation for your health and your teeth. Today, you have learned about a crucial connection that most dentists do not explain to their patients: how your metabolism, especially insulin sensitivity, is directly linked to the health of your teeth. You now know that the ideal combination for lifelong healthy teeth consists of two components. First, the regular removal of biofilms through good oral hygiene and professional dental cleanings. And second, improving your body's resilience through a healthy lifestyle. If you would like to learn more about how we take this holistic approach in our practice, or if you are already noticing signs of periodontitis and are seeking comprehensive care, please feel free to schedule an appointment at our practice in Potsdam. We will create an individualized plan for you that takes into account both dental aspects and metabolic components. Because our goal is for you to have teeth at 80 as healthy as you did at 18. You can find the link to schedule an appointment in the video description. If you enjoyed this video and want to learn more about these connections, simply subscribe to the channel. It's free, but it could change your life. And leave a comment with your questions or experiences. In the next video, we'll talk about how you can further reduce your tendency toward inflammation with targeted nutritional supplements. Until then, stay healthy and don't forget, a beautiful smile for life.